McShin Foundation is Virginia's leading peer-to-peer recovery organization. If you or a loved one is struggling with addiction, let us get you connected. We can help you build a solid foundation through recovery. Here at the McShin Foundation, we are committed to healing families and saving lives.
Dr. Courtney Boyle, and I am an obstetrician gynecologist for Lehigh Valley Physician Group here at the network. And as they said, I am also the medical director of the Connections program. So when I was asked to talk, anyone that knows me knows I have a lot of things to say about this because I feel so strongly about it, so I was told 10 minutes. So it's kind of hard to try to decide what to say. So I started with, start with a story and kind of tell you what we deal with in our program and, tell a story of a patient who came to us. So imagine this, you're 21 years old and you're living in a hotel. You're dating some guy because, he promised you the world and everything that you could ever dream of. And somehow that didn't all work out the way you planned. And you're using heroin and it's not really anything you ever imagined your life would be. You hate where you are, you hate how you got here. And then one day you realize, you feel this pain and you're like, something just doesn't feel right. And at that moment, it clicks, and you're pregnant, and there's a flood of emotions. You're scared, you're hurt, you're angry, you're so disappointed in yourself. These are the patients we see in our Connections program. And they come to us, and, it reflects everything everyone else has said today. The fear of the stigma, they're afraid to go to the doctor because what's the doctor going to think? And as many of us know, up until recently, there really wasn't many resources. If you checked into a rehab and they checked a UPT and it was positive, unfortunately, they'd send you on your way with the best of luck. But over the last few years, we've kind of clawed and kicked and pushed, and fortunately, the network was able to buy in with some amazing community resources. We were able to get some funding from Lehigh County SDA, and we came up with the Connections program. And I think it has the perfect title because, as you know, this isn't something that one person can fix. It takes lots of different people and from all different walks of life. In our Connections program, when we started realizing, what do the patients need? And we know that in pregnancy, that detox is not recommended. There's, theoretical risk to baby and to mom, so it actually is MAT. And the problem was we couldn't really find any providers that felt comfortable treating our pregnant moms. So myself and another obstetrician, we decided to take the training and got trained and were able to prescribe buprenorphine. But as we all know, that's only a piece of the puzzle. So fortunately, we were able to pair up with a local drug and alcohol through Pyramid, and they were agreeable to start taking our patients in inpatient, which previously was unheard of, especially in this area. I'm very fortunate. We have a great team to this point. We continue to grow and to add people to our team. I have a community outreach liaison recently hired who goes out to the community, and she is able to identify some of the barriers that the patients have. She will sit down with them and fill out paperwork and forms, and we know childcare is an issue, we know transportation is an issue, and they work through that. I have a clinical case manager who I often refer to as the glue that holds us all together, because she sits with me during our visits and she meets up with the drug and alcohol team. She meets up with our community outreach liaison. She talks to all the different treatment providers to kind of make sure we're all on the same page. We're very fortunate that we also have, dedicated nursing staff. So when a patient walks into my office, it's scary. They're walking in and they contemplated 10 times over if they just waited another month, nobody would know. Is anyone going to realize if I just wait another month, my urine will be negative by then? Maybe they won't ask the question. So it's scary. But once they know that they can trust us, they pick up the phone and they know the nurse that's going to be on the other line. And they can ask her those scary questions. They can get to direct contact to me. And then we also, in this kind of expanding and growing, we also have a medical assistant who, when the patient walks into our waiting room, again, can be traumatizing. They're scared. They don't know what someone's going to ask of them. I have a dedicated medical assistant who walks out there. They know her, she knows them. They come in with a smile on their face because they know that when they come there, they trust us, and they know we're with them. We feel their struggles. We sit there, we hold their hand when they tell us that, they're really struggling, they're having a hard time. We reach out to the drug and alcohol, because sometimes, what they tell us isn't the same, and what they tell them may not be what they tell us. So we really try to walk with our patients. We walk the walk with them, and we, do our best to tell them that, you may feel like this is the worst place, and you're down and out, and you don't know what to do, but we're going to hold your hand, and we're going to get you there, and we're going to walk you through it. And it's scary, and it's hard, but you're doing the right thing. I have lots of things to say, and, we try to pair up with our inpatient side. So, the outpatient setting is one thing, but then you have to show up and actually have this baby. And as much as I would love to, I can't be on call every second of every day. So, we pair up with our NICU providers, and, we get our patients in to see the NICU and to sit down and to talk with them, because having a baby go through withdrawal is also scary. So, our moms are scared. This is not how they ever intended becoming a mom. And alleviating some of those fears by letting them sit down, and they're meeting with a provider who's actually going to care for their baby. They know what to expect. They know what the length of stay can look like. They know what the medications are going to look like. So to alleviate some of that stress, we paint this picture of, these are the people when you get to the hospital. These are who you're going to see. And then they also get a consult with our team. So someone from my team actually goes and meets with them in the hospital, and it's kind of, wraps the whole package up, like, this is what's going on. So if I can leave you with a few different things, I think that, when our patients come to us, their fear is always the stigma. The stigma from around them, their friends, their family, the stigmas from the medical community, the fear of not really knowing what other people are going to think, not really knowing what to expect, not really knowing what the next day will hold. And what I try to tell people is, we're going to take this one day at a time. We're going to hold your hand through it, and we will be there for you. And if no one told you today that they care, I care. We care. And as a network, we know that you can recover. Thanks.